Greetings, Iowa HOSA members. On behalf of our association, I'd like to welcome you to the Healthcare Frontline series. This year, we are bringing together business and industry leaders in a virtual format to help you as members see the many career opportunities in healthcare. My name is Yula, and I'm your Iowa HOSA Vice President of Fundraising for the year 2020 to 2021. I'm excited to be here today with our healthcare expert, Caroline Weeks with Mayo Clinic. Caroline here serves as a pediatric registered dietitian and also does nutrition communications in the healthcare industry. We're so glad that they have joined us today to give us insights into their career field. Please join me in welcoming Caroline.
Hi, Eula. Thank you so much for having me.
Thank you, Caroline, for being here with us today. Before we begin, I'd like to give you the opportunity to introduce yourself to our members. Can you tell us a little bit about yourself and the organization you work for?
Sure thing. So again, my name is Caroline Weeks, and I'm a pediatric registered dietitian nutritionist, and I currently work at the Mayo Clinic, which is a pretty large hospital. Maybe some of you have heard of it, or maybe some of you have family members who have whatever reason needed to come here for care. But I grew up in the state of Iowa and am an alum of Iowa State University, where I completed degrees both in science, in dietetics and nutrition, as well as music performance. I'm actually a classical musician as well, and that's what I started out as a musical performer and all of that. I'm a violist, as I mentioned, so stringed instrument, but just kind of found my way to healthcare and never looked back. I'm so happy that I decided to pursue both degrees, and now I work in healthcare. So that's a little bit about me.
That's amazing. And if you're ready, let's get started with some questions about your experience. What education was required?
So, for the registered dietitian nutritionist role, there is a decent amount of background education required to be a practicing licensed registered dietitian. And I will give a disclaimer and say it's a little bit dependent on what state you intend to practice in. So, for example, the states of Iowa and Minnesota require a license, and that's the very last thing that you get after finishing your degree. So, I went to high school. I completed a high school education. Then I went on to fulfill a 4-year college degree, although I did start out taking a few courses at a community college before going to Iowa State. And I was really glad that I did that because I was able to save money and prepare and really know that nutrition was what I wanted to do. So then, once I graduated from Iowa State University with my bachelor's degree, at the time, a registered dietitian needed to go on to fulfill what we call a dietetic internship. And that is usually about an extra year of clinical training, where I sort of call it like a mini residency, where you're hands-on with patients, you work in a hospital environment, you work in the community doing community service projects, and you get thousands of hours of experience so that you can then sit for your board exam. So there's kind of a long process,
It's
right?
quite a
Then
process.
yes, it's quite a process, but so worth it. So I passed my boards, they say, which was a really long test. I want to say like a 4-hour long exam. And you only have to take it once as a dietitian, at least currently. And then I was able to become registered and credentialed. And then I applied for a license, and now I see patients. In the future, and for current students that are thinking about nutrition as a possible career path, you will be required in the future to go on to get a master's degree to further hone your skills and your training. So that's sort of the next step in the line for this profession.
So, do you hold any certifications and did it require extra work or education like masters or a lot of summer classes?
Sure. As of now, the certificate that I hold is a certified registered dietitian nutritionist. So that's kind of a certificate in and of itself.
Mhm.
I actually have not gone on yet to do my master's degree because when I graduated, I was what they call grandfathered in, right? So I didn't have to fulfill that master's to practice with patients. But it's something I intend to hopefully do in the near future because I love being a lifelong learner, and I think it's important to continue to explore and expand your horizons as a professional. But I have currently not sat for any certifications or other board exams, although that's a definite possibility for you as a registered dietitian. So, for example, if you're interested in oncology or serving patients with cancer, there's a specific certification you can get. If you're interested in helping people lose weight, there's a specific certification for that. If you're interested in sports nutrition, helping athletes, there's a cert for that. There's so much you can pursue in this role.
So would you say masters and beyond that would be required, or is it depending on state and what you're really striving for?
The master's degree will be required of all states in, I believe, 2024, although don't quote me. So in the near future. But other than that, you do not require a doctorate degree, a PhD to practice, at least at this time. So that would be it.
Describe a typical day for you.
Sure. So, a typical day for me working at the Mayo Clinic involves waking up. I eat breakfast because breakfast is the most important meal of the day, as your dietitian so tells you. And I go to clinic. So, I work in a healthcare setting called outpatient healthcare, which means I see patients that are not sick in the hospital. They have more chronic long term issues that they're battling. So we call it ambulatory care. The patients are up and walking around, they come to clinic and then they go home. And so I have a patient schedule and patients get on my calendar and I see them. So from kind of a 8 to 4:30 type setup where I work with patients with all different complex medical needs. And I work, as you mentioned, in pediatrics, meaning I work with kids. And so I see kids' parents as well as the children themselves. And the current populations that I work with right now in healthcare vary quite a lot. So I cover what's called subspecialty clinics at the Mayo Clinic. So I see children with gastrointestinal disorders, like something you might have heard of Crohn's disease or irritable bowel syndrome. I see patients with genetic disease, which is called cystic fibrosis. I am a dietitian for that clinic here. I also see babies that discharge from our NICU. So babies that were born preterm or early and then have medical complications from the first day of life. I see them once they get better and they grow and they get out of the hospital. So a large variety of different conditions. That's only a few to name. So the interesting part about where I work is we see very complex patients. Sometimes the medical mysteries of the world come to Mayo Clinic, and it's up to our doctors and healthcare professionals at this center to sort of uncover those mysteries and give families the answer they've been looking for. So it's a real privilege to be able to work with such brilliant minds.
It's pretty amazing. Was this position your original career path or ideal job? You've mentioned music a while ago. If you don't mind,
Right.
how and why did you go into medical instead?
hmm So, like you said, yep, I started out as a musician in high school. I was a really serious musician. I played in orchestra in Des Moines, where I grew up, and was involved in the youth symphony. And then I actually went on to play with the Des Moines Symphony in the state of Iowa part time. And I performed all over the state and things like that. I went to what's called a music conservatory first. I spent 2 years there. And it was extremely intense, that environment where you did nothing but learn music. I had to take no science courses. It was nothing but music all day, every day. And you can imagine, do you play an instrument, Eula?
I can play a guitar, yes.
You can play guitar. Okay.
Yeah,
So you probably know how many hours it takes to perfect your guitar, right? It takes
definitely.
many hours. So I was practicing probably 6 to 8 hours every day by myself in the music conservatory. And I just realized I'm very much a people person and I love chatting with people like what we're doing now. And it wasn't quite the right fit for me. I love music and it's forever my passion, but I wanted something that allowed me to really feel like I was making a difference in people's lives in a more concrete way. So I discovered healthcare. And I was very inspired by prevention in healthcare, right? So, not so much about what medication can you give someone to make them feel better when they're sick, but how do we prevent illness from the start? And that's where nutrition can really come in, and eating healthy, living an active lifestyle, thinking about your health from the very beginning is what inspired me to pursue dietetics. And I had some odd jobs, here and there. Going to college, I worked at a hospital, and I just realized how much I loved the hospital environment. It was like a bustling environment. Everybody was, moving around. It never slept. There were people working overnights. It was just always busy, and I loved that about the hospital. So knew that clinical dietetics, working with patients, was what I wanted to do in my career.
That's pretty amazing. Would do you wish you would have known when you started in your role or organization?
Sure. Um, I think, let's see, that's a really tricky question. I will be honest and say that there are a lot of things that I didn't quite realize would be the case, a lot of things I didn't know starting out. And I'm still young in my career, that's for sure. So I still have a lot to learn. But I think one of the things that I wish I would have known is that it really is up to me and it's up to you to make things happen for yourself. In school, your teachers do such a good job to mentor you and encourage you. But in order to have true success, you've really got to have that internal motivation.
Mm.
And I think, it's something I think I've had growing up, and I've been proud to say that I'm a very motivated person to do well. But it really takes putting yourself out there once college ends and once your career begins. That's really only the start of things. And it's up to you to ask questions and network. Now everybody talks about how important networking is, building your circle of important people, always being the least smart person in the room, right? You always want to surround yourself with people that challenge you and make you want to be a better person. All of that is really important. So that's maybe more some advice rather than what I wish I would have known. But I think that's so important. I think what I wish I would have known is that it's really up to you to continue to find your own mentors throughout your career. That, once your teachers in high school and college are gone, you've got to search out your mentors if you want to keep learning. And so that would be some bit of advice that I wish I would have known when I started.
How has your job changed since you started? Any
Yes.
drastic changes, minimal, anything?
Right. Well, I could talk about a lot of things, but I guess I will focus most on the fact that this is the Frontline Workers series, and we're all living and working through a global pandemic. And I think as healthcare workers, we've had to think creatively and outside the box and have been faced with an unprecedented challenge. And one way in which my specific workflow and career has changed drastically since COVID is telehealth. So, telehealth is the fancy word for engaging in clinical appointments, providing medicine, providing medical nutrition therapy, which is what I do, over a virtual platform like we're doing here. And it's really revolutionized things. It's created greater access to medical care for patients, say, living in rural areas that have to travel far and wide to get to the hospital. Now, anybody with a cell phone can check in with their doctor or their dietitian and have an appointment from a remote area. And that's been quite amazing for me to see. And I think it's an exciting part of the future of healthcare.
Was it a hard transitioning from physical meetups to virtual?
It was, because the thing is, and maybe you know this when you're talking in a webcam, you can't make eye contact with the person if you want to
Definitely.
make it look like you're looking at them. So I'm not looking at you, Eula, but it looks like I am. So that's the hardest part for me. It's less personal. There's a little bit less of a personal touch. And as we all know, food and nutrition is a very personal thing. Food is culture, food is life, food is family.
Mhm.
Food is how people express themselves. I don't know. What's my favorite food? I love French fries, pizza, and sushi. So that's my personality in food. But so I think that's been the hardest part, is not being able to have that personal element to the visits. But I try to be as animated as I can on the camera to connect with people. So we make it work.
What is your favorite part of the job?
My favorite part of the job in working with children and families is seeing the impact of my recommendations just take life and really take form in a very short amount of time. So, for example, when I see a baby who is, say, maybe 4 weeks old, and they're having difficulties growing, and the baby was born with a heart defect in the NICU and they had medical complications. Typically, babies with that background have some feeding difficulties and they have trouble either breastfeeding or taking a bottle, but they need to grow to get a surgery that will save their lives. So, one of my jobs as a pediatric dietitian is to see infants and to help their mothers understand how to best feed them in a way that will help them grow. And to be able to see a baby who's really not growing very well in the beginning to all of a sudden thriving is just so rewarding to me. And to see, especially first time parents, their eyes just light up when their baby's making progress, that's a lot of fun.
It really sounds fun. I would like to see that one day, just the transition from being weak to in
Yes.
something.
And I also get to watch kids grow up too. Being in pediatrics, I get to see kids grow, and I'm almost like part of the family. So it's a lot of fun. And I get to hold cute babies all day at work. So it doesn't get any better than that.
It's amazing.
Yeah.
What is the important skill you need to be successful in the field?
I can think of so many important skills that you need to be successful. Communication is number one, being able to speak clearly, confidently, and really have that self confidence.
Mhm.
I think a lot of what discourages or kind of intimidates people to go into the science field is they think, oh, I'm not so good at math, or, science is just not my strong suit. I guess one thing I wish I would have known is it doesn't matter if you're not that great at math or science. Honestly, when you get into the field, it's more how you relate to people. It's more how you relate to your colleagues, how you can motivate people and teach and educate them. That's really what healthcare is mostly about, to make the best impact in a person's life. So being able to have that self-confidence is such an important skill. And I think it's such an important skill for women
Mhm.
of color, that want to achieve their dreams, and maybe they're the first person in their family to go to college or work in healthcare, and they've seen somebody do that job and they're like, yeah, I want to do that, I can do that. So having that self-confidence is so important. And then I think, just because we're talking along the lines of COVID-19 and working in a pandemic, being flexible and adaptable and resilient, all of those things are critical to really succeeding as a professional, at least in healthcare.
If applicable, what groups or activities like professional associations or organizations should you be involved in to be best prepared for the field?
That's a great question. As a student, I was involved in the Academy of Nutrition and Dietetics, which is the national sort of accrediting body for my profession. And I had a lot of great opportunities through that group. I was able to get some scholarships. I was actually one of the most fun things I was able to do through my local chapter in Iowa of the Academy was I got a scholarship to go to Capitol Hill in Washington, D.C., to actually speak to legislators about the importance of prioritizing nutrition in their policies. And that was probably one of the most inspiring events I was ever able to participate in, because I saw how my expertise as a professional made a difference to the people at the local level. So being a member of that is important. I currently am also a member of Aspen, which is an academy for nutrition support. So people who are critically ill, who for whatever reason can't eat by mouth, they eat by other means. So via a feeding tube or in their blood via an IV. So I am a member of that group, and I'm also a member of another pediatric specific GI group. So lots of opportunities to get involved in societies and groups and things like that once you find your niche.
As we're closing out our interview for today, is there anything else you would like to share with Iowa HOSA members? Any life advices, tips, and tricks?
Yes. I think just my advice for students, especially in your role, is it is so hard to understand and know what you want to do when you grow up. I
Definitely.
always joke and say I am still trying to figure out what I want to do when I grow up. I encourage you ask questions and shadow people and ask for interviews. That was always something I did, even when I was in high school and in college. And I honestly didn't quite figure it out in the very beginning. I had to go through some ups and downs to find my path, and I'm still not done. I could even change careers in the future. I think that's something that a lot of people don't talk about is you can always reinvent yourself. Not many people stick in the only one career in the modern world anymore. They change and they evolve and adapt and things like that. I also want to encourage too, I didn't speak much about it, but I am an entrepreneur on the side and have my own sort of private practice on the side as well. And so do a lot actually on social media with nutrition education. And that's been a huge passion of mine and is super fun. If you have a TikTok or if you have an Instagram, you can follow me. I'm at the Clinic Dietitian, and you spell dietitian with a T. And so I do a lot of education, evidence-based education in a fun, kind of youthful way and on those platforms. And I've had a lot of unique opportunities come from that too. So thinking outside the box, kind of being my own entrepreneur on the side, once I come home from my full-time job, knowing that you can just do whatever you want and there's so many opportunities. It's just about finding what area you want to work in, whether that is in food or nutrition or healthcare. Maybe you want to be a nurse or a doctor. It's whatever you want. But healthcare is a truly rewarding field. It takes heart. It takes compassion, empathy. It takes perseverance. It's not easy to break in and to succeed every single time. But if you know it's what you want to do, then I highly encourage it.
You heard her, guys. Feel free to follow her on TikTok and Instagram. And thank you so much, Caroline, for taking the time to share information about yourself and your job with us today.
No problem. I so appreciate your time.
Iowa HOSA members, don't forget to check out other interviews in our Frontline Healthcare Worker series.